Pharmacology was the study of drugs in the sense of our medications. Toxicology is going to be more of the study of like poisons, toxins, illicit substances kind of fall under this, okay? So every day we come into contact with potentially poisonous things, with acute poisoning affecting over 2 million people a year, with chronic poisoning becoming more common. Okay, now chronic poisoning includes that umbrella of addiction, right? If someone is repeatedly taking heroin, fentanyl, methamphetamine, those are poisons, they are chronically poisoning themselves. You could even make the argument alcohol, right? People who are alcoholics are chronically poisoning themselves. Everyone knows the difference between chronic and acute, right? What's acute mean? Small? It's like a right now problem, right? So what's chronic mean? Yeah, prolonged periods. Yeah, okay, very good. So chronic over prolonged periods of time. Acute, once again, is a right now problem. So death caused by poisonings are fairly rare. Okay, that said, poisoning in children has decreased steadily since the 1960s due to child-resistant caps, okay? Typically, when I've seen kids getting into pills, I've seen it in a couple different circumstances. It's because people leave them unattended, and a lot of times people don't know you can actually break these child safety caps off to make it easier to get into your pills. Like if you're a grown person who's responsible for your own pills, you can't break them off. I've seen kids get into it that way, okay? And then death caused by chronic poisoning in adults has been on the rise, once again, because of drug abuse, right? We know there's a fentanyl epidemic floating around our country. Drug abuse causes people to die. Happens. Same thing, it is still poisoning, okay? Now, toxicology, the study of a toxic or poisonous substance, okay? Now, toxins and poisons are different things, okay? Poison is any substance whose chemical action can damage body structure or impair body functions. So I would phrase it this way. Poisons are kind of an umbrella term, with toxins being specific. Toxins are poisonous substances produced by bacteria, animals, or plants, okay? A poison is just anything that affects our body or impairs function. Toxins specifically are organically made, okay? And then substance abuse is the abuse or the misuse of a substance to produce the desired effect, right? People do drugs because they like the way the drugs make them feel. Okay, they misuse them to get that desired effect. And then we have overdosing, okay, a toxic dose of a drug, right? And overdosing can still include the medications that we administer, okay? Now, once again, the poison is in the dose, okay? For example, you can take table salt, right? The table salt you eat every day. If you were to eat a half cup of table salt, that is enough to throw your electrolytes off so bad in your body that you can actually start having cardiac problems, even go into cardiac arrest, okay? The poison is in the dose. How much of it you're consuming is gonna make a difference. Does that make sense? Everyone see where I'm coming from with that? Okay. So for us, our primary responsibility to the patient is to recognize that a poisoning has occurred. A big part of this is the scene size up. If we show up and someone's got a needle in their arm, or I see crumpled up tinfoil with a lighter, or if I see booze bottles on the floor of their crashed car, you can put 2 and 2 together pretty quick as to what happened, right? Or at least have a strong suspicion, okay? Even your sense of smell, like your senses, right? Obviously using sight, seeing the things is one thing. Has anyone ever smelled stale booze on somebody's breath before, stale alcohol? It's a pretty bad, gnarly smell. It's a pretty good indicator, to the point after a lot of my car wrecks, it was not uncommon for the police to walk up and be like, did you smell his breath? Be like, no, did you, right? So half the time you did, yes, but some people in particular would not. Their mouth's full of blood, hard to smell that. But moving on. So very small amounts of some poisons can cause considerable damage or death. Once again, the dose. Now another part of poisons is what it is, right? So for example, remember how I was saying with pharmacology, it's really important to put the unit of measurement in there? We use fentanyl for pain control. We use it therapeutically. When I administered fentanyl, I administered 1 microgram per kilogram. So if you know how that works, King Henry died ugly drinking chocolate milk, right? The unit conversion chart, it's very, very small on the unit conversion, smaller than milligrams, okay? To the point that if you were to take, a full milligram of fentanyl, for sure that's enough to overdose, okay? So depending on what it is and how potent it is can make a difference. But we'll talk about opiates here in a little bit, okay? So the signs and symptoms of poisoning can also vary depending on what they got into. I think that's pretty sensical, right? Poisons will differ. So here's a big, long list of medications, or rather drugs, that I'm not going to talk about. But this last analogy, or excuse me, mnemonic that we'll talk about, sledgem, we'll bring it up again. Okay, that one I promise will show up again. Don't worry about writing it down now unless you really want to, but we will talk about it. Now, if possible, what should we ask our patient? What substance did you take? In my experience, if we wake people up with Narcan, right? What do Narcans do? They only work on one thing. What is that one thing? Opiates, right? In my experience with opiates, I wake them up with Narcan. I'm like, what did you take? They're like, nothing, dude. It's like, well, want to know how I know I don't believe you, right? It's because I gave you Narcan, the one thing that works on this, okay? On the flip side of that conversation, you have people who are if anyone's ever seen someone high on methamphetamine, but methamphetamine, they're pretty forthcoming. Yeah, I took meth. I took meth 2 days ago, haven't slept in 2 days. I've been drinking alcohol to bring my high down, but I took more meth to bring myself back up. And they talk that fast too. They are all over, but they're really forthcoming. Another thing with alcoholics, anytime you show up, how much did you drink tonight? 2 beers. I had 2 beers. That's usually more than 2 beers, I almost promise you, okay? Other questions we can ask. When did you take it? How much did you ingest? Have you had anything to drink before or after you took it? Has anyone given you an antidote, right? Or anything to help get rid of that substance since you took it? And then how much do you weigh? Why do you think how much do you weigh plays a role? What?
Like it will affect somebody who weighs less.
It affects someone who weighs less? What are you gonna say, Bryce?
The heavier you are, the more substance it takes to overdose on.
Yeah, so you guys are on the same page, but yeah, exactly. The heavier you are, the bigger you are, the more it's gonna take to get that effect. Has anyone ever heard about Andre the Giant's drinking exploits? You everyone know who Andre the Giant is, right? The big dude. There was one night where he drank 40 beers in one sitting. A normal human drinking 40 beers in one sitting is not gonna be, they're gonna be vomiting pretty close after that, right? He was a giant man. It took a lot of alcohol to get him where he wanted to be, okay? The bigger you are, the more it's gonna take, okay? Once again, depending on your substance. How much did you ingest? I'll show you guys like medications like IV meds, or no, I don't like the idea of IV meds. IV drugs, I'll say, like heroin, fentanyl, when people shoot it, or meth even. I'll show you how they kind of talk about it. It's something I wish I would have learned a little sooner, but I'll explain those in a little bit. Now, try to determine the nature of the poison, right? Look around the area for clues. What did they take? If we can figure out what they took, we can start to figure out how to help them, okay? Now it says take any suspicious materials with you. I can promise you, if you show up to the hospital with a baggie of black tar heroin, they're gonna be pretty pissed off, okay? What I would say is if it's a pill bottle, someone overdosed on pills, that's usually the big one, take the pill bottle with you. If it's an illicit substance and police is on scene, let police handle that, okay? They're gonna be the ones processing it anyway. And then those containers will give us a lot of information, and I'll tell you what that looks like in a little bit, okay? So, one thing to consider, if the patient vomits, examine the contents for pill fragments. Now, if you end up working for Ada County paramedics, it is in their scope for the BLS provider now to give, what's the word I'm looking for? Zofran. You can give oral Zofran for nausea, okay? Well, if we have someone who overdosed and they're like they took a bunch of pills and they're like, I feel like I'm gonna throw up. We don't wanna give them Zofran. Why do you think that is? We want it out of their system. They're vomiting for a reason. They're vomiting to purge all of those pills out of their system, okay? And it's one of those where no one likes looking at vomit, but if someone took a bunch of pills and they puked, we should look in that vomit to see if we can find pill fragments, whole pills, and then we can kind of do some math and see how many they really took, okay? Yeah?
What are you going to have them throw up into so you can see those pill fragments?
I'm sorry, one more time, Emma.
What are you going to have them throw up into so you can see those pill fragments easier?
Our emesis bags are a clear white color, okay. And so it's one of those you might have to feel it. Okay. In my experience too, it's been I show up and they've already puked on the floor, so it's just looking at their pile. Yeah, yeah. And so note and document anything unusual you see. I had one of my last calls was of an overdose. A little girl, little being like, I don't know, 10, 11, she got into her stepdad's I want to say his drug stash. He had all of his pot in this one cabinet, as well as his antipsychotic medications, his bipolar meds. And she took fistfuls of everything. And then when I showed up, there was a big old pile of pills and a big old pile of stinky vomit. But once again, I'd rather her puke that up than have that all processing in her stomach, okay? So it happens, you're gonna need to look. And then make sure you note and document anything unusual that you see, right? If we find pill fragments, what did we see? If we can get a count on it, how many of them, okay? So how poisons enter the body, how you provide treatment. Oh yeah, Emma, go ahead.
If you see drugs that aren't in like a pill bottle,
Yeah.
Are you gonna call cops if they're not already on scene?
Thank you for bringing that up. So if we see, and I'm assuming you mean like illicit substance stuff. So it might be one that we can definitely notify PD, right? We can go over the radio and be like, hey, dispatch, we have illicit substances on scene. Can we get PD en route? That would be a good one, right? Now, kind of backtracking to a different concept. For us, we got to remember or remind patients, it's not illegal for them to be high. It's illegal for them to have drugs. It's not illegal for them to be high. And you got to remind them so that they're forthcoming and honest with what they took, right? But yeah, does that make sense, the answer? Yeah, it's one of those things. A lot of addicts don't want to tell us, like, I don't want to tell us what they took. We don't care. I just need to know so I can give you the proper treatment and care. If you don't have the drugs, I can't get you in trouble. Yeah, Bryn.
Why would you want to call that in if you had illicit substance on scene outside of like if you needed their support of them becoming aggressive coming off of like Narcan? Like, I don't know.
Circumstantial is what I would say. Right, if I'm in a household and there's one single parent and they have a single child and there's illicit substances, parent just overdosed, right? We're putting the child at harm if we don't. So it's a circumstantial thing. If it was just some person, you know, by themselves and they had it, debatable, but protocol driven, right? Your agency might want you to do specific actions for it, but I'd say it's pretty circumstantial. Yeah. Okay, so once again, how poisons enter our body. So how you provide treatment depends on how the poison gets into the patient's body, with 4 routes being inhalation, absorption, ingestion, or injection. We kind of talked about all of these, right? Inhalation breathed in, absorption through the skin, ingestion in their mouth, obviously, or perectal, and then injection IV. There are lots of IV drug users out there. And then all 4 routes can lead to life-threatening conditions. Okay, when we're talking absorption, a lot of the time it's going to be something that will have systemic effects. Okay, it's not just like a topical cream, right? It's actually going to cause whole body reactions. So a couple of different examples, right? We have inhalation, absorption, oral, and then injection right there. Moving on. So some inhaled poisons. What are we gonna do? Well, first things first, maybe we should get them away from whatever they're inhaling. I don't know, that feels pretty commonsensical, right? Move them into fresh air immediately, okay? The patient may require supplemental oxygen. And then if you suspect the presence of a toxic gas, this is one where maybe we get hazmat on scene, right? Carbon monoxide is gonna be the big one. CO, okay? Once again, I know I might have given an explanation earlier, I'm gonna give another one. So our body is kind of lazy. Nature as a whole, when it comes to elements and molecules, is kind of lazy. If it takes less effort to grab onto one thing, it's gonna do that. Do you guys remember the chemical equation for the oxygen we breathe? It's O2, okay? O2 is the oxygen we administer. That is pure oxygen, okay? CO, carbon monoxide, has 1 oxygen molecule. Okay, 1 carbon, 1 oxygen. So what our red blood cells do, more specifically our hemoglobin says, when you breathe in carbon monoxide, it says, it's way more work to grab 2 molecules than it is to grab 1. So it grabs the 1 molecule because it's easier, which is why the verbiage you'll hear is our hemoglobin has a higher affinity to carbon monoxide. It likes to grab that easier because it's less work, okay? Now here's the kind of the kicker when it comes to CO. Okay, I'm probably getting ahead of myself. We'll talk about it again. One of the kickers with CO, what do you think their SpO2 is going to look like? It's going to look good. It's going to look normal. Because remember, SpO2 does not read how much oxygen is in our blood. It registers how full our hemoglobin is. Okay, SpO2 is not specific enough to be able to differentiate between the two. It's just looking at how full the hemoglobin is, yes or no. Okay. Now, some patients may need decontamination by hazmat after removal from a toxic environment, depending on what they're in. And then all patients who have inhaled poison require immediate transport. Okay, with our treatment as EMT basics primarily being oxygen, right? If they're displacing oxygen with whatever else they're breathing, let's start giving them what their body actually needs, okay? And then make sure you have suction available. Reason being, people get really nauseated and they start throwing up, okay? And we don't want them to obviously create an airway obstruction because that's more work for us and we are in the business of making our own lives easy, okay? Now, some patients used inhaled poisons to commit suicide in a vehicle with exhaust fumes containing high levels of CO, carbon monoxide. This one I've seen quite a bit. It is a pretty common type. Our treatment is just going to be oxygen. There's nothing we can really do. Let's just give them the oxygen. Let's try and displace that CO. I've seen this a few times. One time, I don't know if I ever told you did I ever tell you my lawnmower story? Okay, lawnmower, yeah. So I was dispatched out to a suicide attempt. The call note said, Dad killed himself with a lawnmower. So my first thought was that this dude turned it on, picked it up, and I was like, that is a metal way to do it. No, what turns out is he just closed his shed up and turned it on. It's like, well, that feels underwhelming almost in hindsight. But it was a CO poisoning thing. Okay, now carbon monoxide does have lethal ranges in our blood. Okay, there's a piece of equipment called the RAD 57 or RAD 47, I can't remember. RAD 57, I believe is what it's called, but it's basically an oxygen SpO2 probe. It also registers CO in people's blood. That's one that is specific enough where you can get carbon monoxide readings. So 10 to 15 showing up on your CO in your blood is deemed a dangerous amount, okay? This guy, the dad with the lawnmower, when we put it on his finger, he had a number of 30 CO, and that's percentage, right? So the only treatment for that is what's called a hyperbaric chamber. They need to go into this chamber and it's going to help regulate their blood gases. Unfortunately, where we live here in Idaho, the one we have is not very big, so it couldn't handle a CO level that high. He ended up getting shipped to Salt Lake, and I believe he died in Salt Lake. But that is your treatment of choice. So it's something where we can do as much as we can to displace that bad gas with oxygen. End of the day, we're still only the Band-Aid. Remember, we can't fix problems. We are the Band-Aid to get them to where we can fix problems. Okay, questions?
Carbon monoxide
I'll get you.
is heavier? Is that a thing?
I'm not sure off the top of my head. I'll look into it. Yeah.
Kind of off topic.
Mm-hmm.
Have you shown up to a suicide attempt and they have a DNR next to them ever?
Oh, that's a good question. Suicide attempt with a DNR. Not to my knowledge, not I can think of the top of my head. I have shown up to suicide attempts for older people who don't want care. Like one in particular, really sad story, is a guy's wife died 3 months before, and he's like, let me die, I don't care. He didn't have a DNR. He has the right to refuse if he's alert and oriented. So it was a problem. But the downside, not downside, but he was put on a psychiatric hold because he was a threat to himself.
Yeah.
So, but I haven't had a DNR suicide to my knowledge.
Okay.
Mm-hmm. Yeah, good question. Okay, so absorbed and surface contact poisons. So can affect the patient in many ways, right? So skin, mucous membranes, or eye damage, right? If we think about our skin, mucous membranes, eyes, those are all avenues to get into our circulation, into our bloodstream, which is where we know toxins, medications, poisons, however you want to say it, that's how we have to get them circulating, right? Getting in our bloodstream. So other ways, you can get chemical burns. You can have rashes, lesions. Depending on the substance, maybe systemic effects, and that's going to be dependent on the substance as to what the effects is going to be. Okay? And it's important to distinguish between contact burns and contact absorption. Is this something that just burned their skin because of what the toxin was? Was it like a hydrochloric acid that just burned their skin off? Or is it such a toxin that causes burns but also was absorbed into the body? Okay? Now, some signs and symptoms of this. A history of exposure. They've had this happen before. A lot of times we see this in like industrial settings. Okay? Is it a liquid or a powder on a patient's skin? So everyone remember, if we have a powder on our skin, what do we need to do? We need to brush it off. And then what are we gonna do? Wash it with water. Yeah, irrigate with water 15 to 20 minutes. If it's a liquid, we're just gonna irrigate it, right? Just flush it with the water 15 to 20 minutes. Yeah, if it's a powder, we gotta brush it all off. So it could be burns, it could have itching, irritation, redness of skin. There can be odors of the substance, right? Just depending on what it was, depending on what they got into, might have a specific smell, okay? I would say if you're smelling an abnormal, maybe chemically odor, that might be a good sign. Let's get out, let's maybe get hazmat involved, okay? So our emergency treatment, first of all, let's avoid contamination ourselves, right? Once again, we cannot help others if we ourselves are hurt or dying. And then remove the substance from the patient or get them away from that as fast as we can. Part of this is gonna be removing all contaminated clothing. Okay, we're gonna obviously get that off. We don't want to hold that poison on their skin. And then making sure we're flushing and washing that skin. So if dry powder has been spilled, we brush off the powder, flood the area with water for 15 to 20 minutes. And then if you have the luxury of soap and water, use those as well. Okay, if it's liquid, you're just gonna be flooding the area for 15 to 20 minutes, like we talked about. If a chemical agent is introduced to the eyes, irrigate them thoroughly. This is some real MacGyver stuff right here. That's a nasal cannula that they have hooked up to a syringe that they are using to flush fluid. I will make one of these so you guys can see this set up on Monday, okay? But you're gonna have to irrigate the eyes. When we irrigate the eyes, do we start with the lateral or the medial side? Medial, why? So what? So it rushes away from their eyes, right? We don't want it to pool up in the middle and then maybe contaminate both, right? Okay, so like I said, many chemical burns are gonna be in the industrial setting. We have Micron, we have HP around here, so if you work in this area, you could run into this. I will say, caveated, Micron has their own EMS team because of the chemicals they use. They are trained in particular to what they carry, okay? So safety showers, they'll have specific protocols for handling surface burns. Those could be available depending on your protocols. A lot of these industrial settings will have safety showers. If you think back to your high school chemistry class, there was that corner shower, right? You'd pull the handle and water would come out and there'd be like the little eye wash station, right? Same thing. Hazmat team, if they're available, get them to assist you. And then sometimes you're gonna have to decontaminate prior to transport. Okay, if they have something that they could potentially be rubbing off onto everybody, okay, that's something we're gonna have to deal with. I'll tell more of this story in a different chapter down the road, but I had a patient out of the prison that to get this guy out of his cell, it took 2 cans of mace, which is pepper spray. I did not know that, so as we're driving from the prison to the hospital, I was like, man, my eyes really hurt. And then the guard's like, oh yeah, he's covered in pepper spray. I was like, that would have been good to know before we were in a 6x6 box going down the road, okay? So keep that in mind. And then obtain material safety sheets. So there's an app, hold on, I have it on my phone, double check real quick what it's called. It's called the ERG 2020. So if you guys have ever seen like those tanker trucks with like gasoline and they have those diamonds on the back, they're all sorts of different colors, some of them have like flames and stuff. Those are known as placards. That ERG 2020 app that I told you about just now, that has what the definitions of each of those placards are. So if you show up and you can pull that out and be like, oh, it's a green one, this is X, right? I don't have them memorized off the top of my head. That's why I have the app. When in doubt, I have it. Okay? Questions on this at all? We'll talk about more specific substances down the line here in a moment. For ingested poisons, so about 80% of poisonings is by mouth. Liquids, household cleaners, contaminated food, plants, drugs, Tide Pods for some folk, okay? Different things, most poisonings are gonna be by mouth, and depending on the demographic, right? So usually with kids, it's accidental. With adults, it's more deliberate, right? Kids don't know what they're getting into, adults do. Not to shoot my own horn, but I do have one life-saving award, and it was for a kid who got into their mom's medications, okay, a little 3-year-old. She made it, she's okay, but she was not in a good place when I first found her, okay? It happens. Kids get into stuff all the time. It happens. So signs and symptoms, burns around the mouth, GI pain, maybe vomiting. Depending on what they took, they can have cardiac dysrhythmias, so their heart can go into a weird rhythm. We'll talk some more about those in a couple weeks. And then seizures. which we'll also talk about in a couple weeks. Now, seizures can be difficult for us from time to time. Okay, seizures can either be the root of the problem, or they can be a sign associated to the complaint, just depending what's going on, right? If someone gets a severe head injury, a seizure is a sign, symptom that we're gonna see, okay? Flip-flop, there are times where they're medically, organically happening, and we'll talk about them down the road. Now, treat signs and symptoms, notify poison control or poison center and medical control of the patient's condition. If you do not have poison control's number in your phone, it is worth putting in your phone, okay? I've called poison control several times while on calls. It makes a difference. They are gonna be well-versed in all the things that we don't know about all the toxins, because there's tons and tons and tons out there, okay? And then consider whether there's unabsorbed poison remaining in the GI tract, so they still have it in their stomach and their system, and whether we can safely and effectively prevent its absorption, okay? Now, for a while there was a med that was also in our scope. It's not really given nationally to the point it's falling out of favor, but that was activated charcoal. We would give charcoal when people would absorb or get these kind of medications or toxins into their system. Nowadays, it's almost quicker just to get them to the hospital and get their stomach pumped. And the reality is activated charcoal is just not used that frequently. Okay, so here we are. Some EMT systems will allow EMTs to administer activated charcoal. So always immediately assess ABCs of every patient who's been poisoned. Okay, the next slides, I believe, or there's gonna be a slide set on activated charcoal. I'm gonna skip it, because like I said, it's not frequently utilized. It is not one of the medications you need to know in your scope anymore.
On the NREMT as well?
Yep. So, injected poisons. So exposures include intravenous drug use, envenomation of insects, arachnids, and reptiles, right? So getting bit, right? So remember, all of it's poison, but we're talking about toxins in particular with insects, spiders, and reptiles. Now, usually absorbed quickly into the body, and can cause intense local destruction, depending on what bites you. That can be really specific. And these cannot be diluted or removed from the body in the field. The old trope of got bit by a snake, cut the spot, suck the poison out, that's not real, okay? Don't do that. You're just getting blood in your mouth that could potentially have toxin. It's just another way you're entering it into your system, okay? I'm sure in environmental, some of you guys were reading through like the spiders and stuff like that. There are some pretty gnarly spiders out there. Like for example, the brown recluse, if that bites you, it's gonna start killing all of the tissue wherever it bites, okay? That's just the type of toxin it carries. So it can be specific to whatever you're getting into, okay? Now, signs and symptoms can range, but may include weakness, dizziness, fever, chills, unresponsiveness, or excitability, just depending on what happened, right? What bit them. So monitor airway, provide oxygen, be alert for nausea, vomiting. There's nothing we can do or give that's gonna help this person in the field. We gotta get them to a hospital. What we can do though, remove rings, watches, bracelets, especially if they got bit in like the hand, wrist, or finger area, because those are gonna swell, yeah. Has anyone ever seen pictures of people's fingers super swelling around rings? It's a real bugger. You're gonna have to get that off. We do on the ambulance, and I'm pretty sure the fire engine does as well. We carry ring cutters, okay? Now, one thing I will tell you though, if you can take it off, because you've never made an enemy like an old woman whose ring you just cut off. She's gonna be pissed, okay? Especially if it's like her wedding ring and you cut that off, she's gonna be really mad. So if you have the opportunity to slide it off before it gets that bad, do so. Don't make enemies, it's not worth your time. Okay, questions on any of that stuff at all? So this is now where we're gonna start going through scene size up, primary assessment, yada, 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 like we were through trauma. I kind of skipped through it unless it's relevant. I'd say scene size up is pretty relevant. Pay attention to what you're walking into, because you're gonna get clues. I can't tell you how many times I've literally shown up to unconscious people in cars and seen the tinfoil. I've seen the needles, I've seen the burnt stuff, okay? Pay attention. You're gonna get answers really quickly, okay? Primary assessment, A, B, C, right? Got to make sure airway, breathing, circulation is good. And then make your transport decision, right, depending on how critical or not critical they are. Get a history. If they're conscious and they're willing to give it, remember a lot of people who use substances aren't always forthcoming with this. But if someone says, yeah, I have a history of opiate abuse, and we find them with a heroin wake up, or we wake them up with Narcan, 2 and 2 is adding up, right? It's just confirming signs, confirming what we're thinking. So sample, secondary, get a physical assessment. We'll talk more about that. I know we haven't shown the hands-on quite yet. That will be part of Tuesday, okay? And then reassess 5 to 15, 5 for critical, 15 for non. Okay, make sure you're writing everything. Make sure you're documenting what substance, if you find it, what potentially it is. If you're not able to identify it, but you can visually describe it, write down the descriptions, okay? Okay, so what does our care look like? First and foremost, scene safety, okay? If the patient's unconscious and we see pill fragments, let's scoop those out. What if we hear patient took a bunch of pills from like a bystander and we look in their mouth and we don't see the pills? Should we start sweeping our finger and looking for those? No, why not? Yeah, we can push it farther, very good. And then if they have dust, or not a dust, a powder on their skin, brush it away, right, before flooding it. If it's a liquid, irrigate it or flush it for 15 to 20. XABCs, X once again standing for exsanguination, or bleeding all your blood, okay? Provide oxygen, perform ventilation as needed, treat for shock. And then some systems will give activated charcoal, kind of like I talked about. We are going to move past this, okay? We do not give activated charcoal. They're not gonna ask about it on your national registry. So let's get into the specific poisons, okay? So over time, a person who routinely misuses a substance may need increasing amounts of it to achieve the same result. This is tolerance, okay? That's what that is called, tolerance. I'm sure not all you guys are legal to drink alcohol, but some of us who are notice it probably took, when we first started drinking at the age of 21, because we're all great people, age of 21 took 3 beers to get drunk. Now we've tenured ourselves a little bit, maybe hated ourselves, it takes a little bit more than that, okay? That's all tolerance. Now, a person with addiction has an overwhelming need to continue using the substance at whatever cost. Okay, with almost any substance having the potential or possibility of being abused. Now, addiction kind of falls under 2 camps, in opinion. One of them is that it's a choice. One of them is that it's a condition, a medical condition. I tend to fall under the medical condition camp. I think it was a choice for them to use it the first time. But after you get using a substance, after a while, you start developing what's called a physiologic dependency, a physiologic need. It's like if anyone's used nicotine or uses nicotine, your body starts to think, I need this all the time, okay? That is a physiologic addiction. We'll talk about one substance in particular that becomes so physiologically addictive that when people quit, they start seizing and it can actually cause them to die. Does anyone know what I'm talking about already? Alcohol. Alcohol withdrawals and dependency. Yeah, alcohol can be so physiologically, which physiologic, remember, is human body function, can be so physiologically addictive, it actually can cause problems that when they withdraw, their body's gonna freak out because they don't have it, okay? So that's why I tend to live under the camp of it's a medical condition that these people don't always have a choice, right? They're gonna get it no matter what. One example, I'm getting ahead of myself, I know we'll talk about it in a bit, but like I said, when people withdraw from alcohol, it causes them to seize, or it can. I had a patient one time, she was in a program to get clean. She was trying to get clean from alcohol. She was homeless. She woke up one morning, and we'll talk about seizures later, but she could feel that a seizure was coming on. Well, she knew it was because she's detoxing from alcohol. So she ended up drinking cooking wine that morning, which if you've ever tasted cooking wine, it's not worth drinking. It's salty, it's gross. She knew it. She's like, I'm not happy that I have to do this, but it stopped me from having a seizure, okay? She's getting what she needed to keep herself hopefully intact, right? Mentally, physically. And it's not that she had much of a choice, right? Her body was reacting. So keep that in mind, right? Give these people respect and dignity. They made a bad choice and they fell into a bad way. It happens. We've all got our stuff. Don't be too judgmental. Yeah. Getting off my high horse now. So the importance of safety awareness and standard precautions cannot be overemphasized. Make sure you're wearing your gloves at minimum, okay? At minimum wearing your gloves. I used to keep my glasses on my hat, and then I used to keep a mask in my pocket because you just never know what you're walking into, okay? And in my experience, especially when it comes to things, IV drug users, because there's a high incidence of HIV, hepatitis, things like that. In my experience, they didn't really tell me until I already had their blood on my hand. They're like, oh, by the way, I have hepatitis. Good thing I'm wearing gloves, okay? Wear your gloves at minimum. Now, one other thing I want to get across. If your hands, your skin does not have any cuts, wounds, little abrasions, your skin is one of the most perfect barriers ever made, okay? You could put yourself, you have no cuts, elbow deep in HIV positive blood and not get sick. Once again, if you don't have cuts, okay? So don't be afraid of everything that touches you is going to harm you. Be aware for sure, okay? But at the same time, try not to panic. I'd still, in my experience, don't let people touch you if they got blood on their hands. Just never know, okay? Questions on that at all? Okay. Well, let's get into it. We talked about alcohol a little bit. So many calls for service have a connection to alcohol use. You're going to see this a lot, especially if you worked in a downtown major metro area. Okay, it's not only the homeless population. If you've been downtown Boise on a Saturday, Friday night, those college kids get rowdy. Okay, happens. You're going to see a lot of alcohol-related calls. Now, alcohol can damage the liver, whether chronic overuse or occasional heavy use, binge drinking. We're in America. We tend to do a bit of both. With the younger we are being binge drinking more typically. I don't drink Monday through Friday or Monday through Thursday, but Friday to Saturday I drink 12, 15 beers a piece, right? Still not great for you. Now, binge use can be more damaging than chronic use, depending on how frequently you're binging, okay? There are going to be consequences to that. Now, alcohol is a powerful central nervous system depressant, okay? It causes all of your internal systems to kind of lower a little bit, right? Suppresses the function of your nervous system. Okay, so it decreases activity and excitement. It induces sleep. It dulls your senses, so your awareness, your reflexes, your reactions times, those all slow down. Depending on the person, they can make you aggressive and make you act inappropriately, right? Obviously, lack of coordination. I'm sure a lot of us have seen a drunk person fall down a time or two, okay? And then alcohol also increases the effects of other drugs and commonly taken with other drugs, right? Party substances. Alcohol is usually the substance of choice at parties with whatever else showing up, okay? Now, there can be what we call potentiating effects. So alcohol is a CNS depressant. Opiates are also CNS depressants. So if they take both at the same time, they're doubling up the effect, okay? So if a patient exhibits signs of serious CNS depression, provide respiratory support, right? If they're really slowing their breathing down to the point that they are slowly dying, we're gonna have to provide ventilations. That said, have suction ready. Drunk people puke, okay? May experience frightening hallucinations or DTs. Delirium tremens is what it's called when patients go into withdrawal from alcohol and they start to seize. DTs. You'll hear lots of jokes, usually made by callous first responders saying, I gotta drink my mouthwash before I start the shift, stop the shakes, right? It's usually a joke. I'm hoping it's a joke with most people, but that's what they're referring to as DTs, okay? Pro tip, one thing I wish I would have learned while I was still in school. If you take one of those, red biohazard bags, they're just garbage bags, they're a little smaller, and you move it, you like take one side of it and you pop a little hole in there, and leave a ring. You can put that over their head. That way when they puke in the bag. It's called a lobster bib. It's a smart idea. It also stops you from getting puke on your shoes. Because I've had that happen and nothing will piss you off worse at 3 in the morning. Okay? Now, DTs, delirium tremens, characterized by agitation, restlessness, fever, sweating, tremors, right? Tremors can often turn into the seizures, confusion, disorientation, and then they can have delusions and hallucinations as well. Okay, with obviously seizures being the tremors as well. Does anyone who's of legal age to drink, has anyone ever noticed that when you have a night of being intoxicated, you wake up really early the next day? I know why that is, if you don't know. So remember the concept of homeostasis, the balance that our body's always searching for? Well, alcohol is a CNS depressant, so it brings everything down, right? Everything just kind of slows down. So our body says, well, we got to fight that. We don't want to over-depress. So it ramps itself up. It releases more of the awaking chemicals. So then by the time the alcohol comes out of your system, 6, 7 a.m., you pop awake because everything else takes over. Fun facts. Learning all the things. Questions about alcohol at all? Okay, Okay, opioids. Opioid is a type of narcotic medication used to relieve pain. Okay, so an opiate is a subset of the opioid family and refers to natural non-synthetic opioids. Opiates are naturally occurring. Okay, so opium comes from poppy seeds, so codeine, morphine comes from they're opiates. Opioids are synthetic. So hydrocodone, fentanyl, Dilaudid, okay, those are all going to be opioids. The way I remember is opioid reminds me of androids. Androids are robot humans, right? They're not full organic beings. I'm a nerd about things, but if it helps you remember, help me remember. Okay, so big long list. Statol, codeine, fentanyl, heroin, hydrocodone, hydromorphone, morphine, methadone, oxycodone, oxymorphone, all sorts. Okay, the ones that we give therapeutically, we give fentanyl, which obviously is being abused. We give morphine, and then in the hospital, hydromorphone, Dilaudid. That's going to be one of the most potent opiates. Okay, so morphine is kind of our standard when we think opiate. Okay, now fentanyl, part of the reason it's so dangerous is fentanyl is 100 times more potent than morphine, meaning it takes way, way less to overdose. Okay. For context, Dilaudid is 1,000 times more potent than morphine. That's why it's only administered in hospitals under stern supervision. Okay? Now, prescription opioid drugs are pretty commonly abused in our country. Okay, with some people becoming physically dependent, there's that physiologic dependency or physiologic addiction. But they become physically dependent on opioids after taking it after appropriate medical care. I've seen that one several times. People get into using illicit substances because they broke their leg, arm, whatever, to the point or had a surgery, they take pain control pills, right? They take their hydrocodones. Well, they like the way they make them feel. And then the body starts to become addicted to that, to the point when they are no longer there, they're out of their pills and they can't get another prescription. They go looking for it, and that's how they find their illicit substances, okay? Now, these agents are also CNS depressants, like I said, so this is why if you mix these with alcohol, they tend to go into overdose really quickly, okay? And can cause severe respiratory depression and then cardiac arrest if not treated promptly. Our big concern of CNS depressant is that respiratory depression. They're going to slow down their breathing, their body's breathing mechanism to the point they stop breathing, okay? If they stop breathing, they're no longer bringing oxygen in. What do you think the heart's going to do after that? Probably stop working, right? It's going to go into arrest because it's no longer getting the fuel that it needs, okay? It's not getting the oxygen. So some users may require massive doses to experience the same high and often cause nausea and vomiting, which also can lead to hypotension, right? If they're nausea, vomiting, they're losing fluid being lost from their vasculature, they're dehydrating themselves, their blood pressures can go down.
Is that what causes the hypotension?
It can, but part of it's that CNS depression as well. Yeah, it's a mixture, depending. Now, I said I was going to show you guys what they use out there, and I'll show you what I mean. Okay. I'm not going to open it, but this guy right here is a tuberculin syringe. Okay, this is the type of needle when you guys hear they give out needles for users, right? Because they don't want diseases spreading. These are the clean needles. This holds 1 milliliter of fluid, okay? So 1 is the maximum. So every dot you'll see is 0.1, 0.2, 0.3, 0.4, so on until you get to 1 milliliter, okay? So when they take this, what I learned out in the field was that they would be like, okay, if they fill it to 0.3, they took 3 points. That's how they register, right? Because heroin is not one of those medications. It's not a med. There's no measurable doses, right? So they'll say, oh, I took 3 points. Well, this is how we can tell if somebody took, or if there's a bad batch of stuff going around, right? If I have a patient I just woke up with Narcan, I'm like, how many points did you take? Which usually if you use their language, they tend to respond pretty well. And they'll be like, oh, I took 2 points. I was like, oh, and that caused you to overdose. How much do you normally use? Normally I use 6 points. Oh, okay, then I know the stuff that's going around is really potent. We've got some bad stuff going around, okay? That's one that I wished I would have learned while I was still here. They tend to listen, or not tend to listen, they tend to respond better when you use their verbiage. Yeah?
Are there community resources or folks here that are, like, if you're noticing that trend in the field, community culture, whatever?
Community paramedics. They feed into it because they see a lot of the, like here, they see a lot of the addicted personnel, like homeless folk, and then they have reports that they make to different people.
Okay.
Yeah, but they're the ones who, like, that's our first line in the sand.
And that would like connecting to social workers or other
Yeah,
and working with those communities out in like a.
Yeah. Yep. And that looks a little different. I can't speak to everywhere, but that's how they do it here. Yeah. Very good. Okay. So yeah, and then remember the idea of tolerance, right? The more they use it, the more they're going to need to use to achieve that same high. Okay. Now, although seizures are uncommon, they can occur, and these patients will typically appear sedated or unconscious, sometimes cyanotic. Now, hint, hint, wink, wink, our identifier of opiates is pinpoint pupils. When you see someone who overdosed on opiates, their pupils are going to be teeny, teeny, tiny. Okay, super, super constricted. So when we're doing our medical assessments, what do you think you're going to need to check? Their eyes, right? Very good. Now, naloxone is going to be our drug of choice, right? Narcan gets rid of that opiate. Rather, it replaces the opioid, and it stops the depression. That said, once again, depending on what they took, the opioids can outlast that Narcan. Okay, so it might just be a temporary thing. Now, for most systems, or in many EMS systems, EMTs will do intranasal, which is the route we will teach you guys to use, okay? Now, it says Narcan should only be used in patients who have agonal respirations or are apneic, okay? If they are not breathing, that's a reason to use it. Now, before we give, so let's say we show up to an overdose. We see the pinpoint pupils. We know it's opiates. We know Narcan's the answer. What should we do before we give them Narcan? What are they not doing? Breathing. So what do you think we got to do?
Check their.
Yeah, check the pulse, but we can actually get involved with something. Ventilate them. Yeah, so if we show up and we have an opiate overdose, we got to BVM for them first, okay? Because it's going to take time. We still got to grab the Narcan. We got to pull it out. We got to get it hooked up. That whole time, the patient's still not breathing, okay? That is going to be something, hint, hint, wink, wink, shows up later. Okay? Before we administer Narcan, the first thing we need to do is use the BVM and oxygenate this patient. In my experience as well, I've found that if you oxygenate the patient before you give them Narcan, they tend to wake up and be less crabby about stuff. Okay? Because you're basically, if you slam a bunch of Narcan into them, you're taking them from an oxygen level of 60 to a moment where they need 100. And their brain's going to be panicking. And that's why they tend to get up, fight, puke, do the whole thing. Okay? Now, in some areas, the layperson is permitted to administer Narcan, find out from bystanders if they were given Narcan. Nowadays, a lot of agencies are having leave-behind Narcan kits. Mixed opinions on that. When it comes to the people who produce the medications that are killing people are also the ones who produce Narcan, but I digress. So, we are leaving behind. So if you show up to a bunch of users, right, we wake someone up, and we know they're all using, they're conscious at that point, we might leave one behind on the off chance it happens again. Now, one thing I want to get out of the way, this is a common thing. How many of you guys have seen the videos of police officers getting fentanyl on their skin and freaking out, right? It's been everywhere for a while. So fentanyl as a powder is not transdermal. It is not transdermal, okay? If you watch those videos, the police officers get it on their skin and they get really anxious and fired up, right? And they're like freaking out about it. That's not what it does. We just spent time talking about it. Opiates depress everything. They bring everything down. They make you tired, sleepy in comparison, okay? Now, there are fentanyl patches. Those are designed to be transdermal, right? There's that chemical in the patch to make it go through your skin. Now, I'm not saying that, obviously it's a scary situation, right? They're gonna be around unidentifiable powders. Who knows what that powder is gonna do? I level with that, for sure. And if they get that fentanyl powder in their nose, their eyes, their mouth, yeah, for sure, they can start having effects of it. But just getting fentanyl on your skin is not a transdermal medication, okay? It will not do it that way unless it is designed with the patch to go through your skin. Questions, comments, concerns on that? Okay, don't have to have the argument. I've argued with a few people in here about it. So, moving on, barbiturates and benzos. So, barbiturates and benzos are also CNS depressants. We use these for seizure control, okay? They alter the level of consciousness And they can make patients appear drowsy, peaceful, or intoxicated. Okay, this is another one that can potentiate with alcohol. This is one that we lovingly refer to as the soccer mom overdose. They take a couple of Xanax, drink a bottle of wine. Next thing they know, there's a bunch of us staring at them in their house. Okay, it happens. Now, there is no, Narcan's not going to work on these. Okay, there is a kind of Narcan for benzos. It's called Romazicon, but we don't carry it. That's a hospital-based medication. Okay, now these agents usually taken by mouth. These are going to be one of the commonly abused prescriptions. Occasionally dissolved in water and injected, and they have a sedative-hypnotic effect. They induce, or excuse me, and they can quickly induce tolerance. That's why people who are like Xanax addicts, they take more and more Xanax till eventually they overdose on it because they build a tolerance to it really, really quickly. Okay? Now these drugs may also be given as knockout drugs in drinks. And then the treatment is to ensure the airway is patent. Ventilations are assisted, right? If they're gonna have a CNS depressant, their central nervous system, their brain stem, necessary to life functions, going down, we gotta assist their breathing, okay? And then get going, because there's nothing we can do to fix it, but we can supplement with oxygen, okay? So I have a story about the knockout drug thing. I have a buddy, he went to a bar with some of our other friends. I wasn't able to go out this night, which in hindsight, I wish I was. But anyway, he showed up to the bar. Now this is one of my friends that was like a delinquent friend of mine. Like while we were in our early mid-20s, going wild. Like I've seen this guy black out several times. I know what it takes drinking for this guy to be over the edge, okay? So that night, apparently he had 2 beers and a shot, okay? Well, that for him is not that number. It's too much for him to drive, and he was aware of that. He was gonna Uber, but it was not enough for him to black out. Well, so when he showed up, he ordered his first beer, decided to play darts with our friends. When he threw the dart at the dartboard, say this is the dartboard, there was a guy standing right here to the side of the darts. My friend hit the dartboard. This guy freaked out on my friend, saying I could have you arrested. I'm a federal agent, making up a bunch of stuff that I don't believe to be true. Neither did he. Yada, yada, yada. The night goes on. Okay, so as they're leaving, right, he's getting his Uber ready to go. Everyone's leaving. This guy comes up and challenges my friend to a game of darts as like a preserve his honor type thing. So my friend said, sure, buys 1 more beer. So I guess he had 3 beers in the shot. Buys 1 more beer. Well, as a male, we don't typically watch our drinks. Okay, so he's putting his drink down, he's playing darts. The next morning, I get a text message from him saying, my girlfriend is really, really mad at me. She just picked me up. She picked me up off the sidewalk. And for reference, he was at a bar on Maple Grove and Ustick. He lives south of the Costco on Cole. His girlfriend found him passed out on the sidewalk in front of the Fred Meyer's on Overland. He tried running home. Turns out, he asked me, I don't know what to do. I said, you should take a drug test. And sure enough, he tested positive for benzos. So this guy drugged his drink. Okay, so what I'm trying to say is the moral of this story, nobody is safe out there. Keep an eye on your drinks, okay, because you never know what kind of scum are lying around and who's gonna be doing things they definitely should not be doing, okay? Just keep yourselves protected. Keep your eyes on your stuff, because once again, people suck, okay? Question, comments, concerns on benzos. Okay, moving on. So abused inhalants. So these are inhaled. So things like acetone, toluene, xylene, hexane, different kind of gases, different compounds, right? So these are found in glues, cleaning components, paint thinners, lacquers, canned air is another one, right? These are just preservatives. Gasoline is another one where halogenated hydrocarbons, when people huff gas, that's what they're breathing in, are also abused. Now these are commonly the ones abused by teenagers. These are also ones that, in my life experience, the people I know that use these, a lot of them are dead now because they moved into bigger drug addiction. Okay, when they start these at younger ages, it tends to disrupt brain function. They're displacing oxygen in their brain. They're killing cells. Yeah. Yeah, when people huff, when they put paint in a bag and huff it, that's exactly what they're doing. Yeah. Yep, so for us, use special care. So hydrocarbons, those halogenated hydrocarbons, if people are huffing gas, it's kind of a similar effect to when people's heart get really cold, right? Their heart gets irritable when they get cold. Well, those hydrocarbons make their heart really sensitive, to the point they're sensitive to their own adrenaline, okay? So let's keep the situation cool, calm, collected, because if we get them amped up, they have a fight or flight response, they can actually go into cardiac arrest because of their own adrenaline produced in their body. Okay, so keep patients from struggling or exerting themselves. use a stretcher to move the patient, give them oxygen, get them to a hospital, okay? That is our management. There's not much we're gonna do for these people, okay? Okay, let's move on to the next one. So hydrogen sulfide. Hydrogen sulfide is a gas, okay? So highly toxic, colorless, flammable gas with a distinctive rotten egg odor, okay? Affects all organs, but it has the most impact on the lungs and central nervous system. Okay, you guys are gonna start noticing the trend of central nervous system, right? Because we're displacing oxygen. If you're breathing something not oxygen, our body cannot use that as fuel. Okay, so it's gonna start reacting differently. Often used to commit suicide. And then if you suspect the presence of any toxic gases, once again, hazmat, okay? Now our signs and symptoms, nausea, vomiting, confusion, dyspnea, or difficulty breathing, right? Loss of consciousness, seizure, shock, coma, and then cardiac arrest. Once the patient's been decontaminated, management is largely supportive, okay? You're gonna notice supportive care is gonna be a pretty common theme, right? If it's not something we can do something directly about, right, i.e. not opiates, we can't give any medications, our care is gonna be mostly oxygen. Let's get them to definitive care. Let's get them to a hospital, okay? So that is supportive care. So monitor and assist the patient's respiratory and cardiovascular functions, and then rapid transport, okay? Okay, so sympathomimetics, that fancy word is showing up again. Things that mimic our sympathetic nervous system, okay? These are stimulants, okay? So CNS stimulants that mimic the effects of the sympathetic nervous system are sympathomimetics, once again, okay? These are also what the kids refer to as uppers, okay? Like benzos and opiates, those are the downers. Things that make you feel sleepy are downers, things that make you stimulate are uppers, okay? So sympathomimetics produce an excited state with obviously all sorts of examples on here: MDMA, methamphetamine, Molly, cocaine, ecstasy, yada, yada, yada. So frequently they'll cause hypertension, tachycardia, and dilated pupils, right? If we think about stimulant mimicking our sympathetic nervous system, our heart rate goes up, our pupils get big, our blood pressure goes up, right? Because we're managing or mimicking the fight or flight, okay? So things like amphetamines, methamphetamine, phentermine hydrochloride, and then benzodrine are some examples. There's also the designer drugs, so MDMA or ecstasy or Molly, all sorts of different names, frequently abused. And then these are also commonly taken by mouth. Sometimes they are going to be injected. So methamphetamine is one of those that can be injected. In my experience, like I said, methamphetamine tends to be one of those where they're really forthcoming. One of my favorite patients' favorite calls of all time. It was actually my fastest call from point of dispatch to arrival at hospital of a whopping 12 minutes. We was working by St. Al's. We drove down the hill. There was a guy who said, "My feet hurt. I walked here from Seattle. I'm on meth." And I said, "Cool, get in." And so he was one of my favorite patients just talking to. He had a lot of interesting facts. Like he's like, "I don't know if you know this, but I'm a business owner." I was like, "Oh yeah? What business do you own?" He's like, "I wash car windows. Sometimes I do it when they don't want me to." It's like, "Okay, cool, man." And he's like, "You know what? I'm a soldier." I was like, "Oh, really?" He's like, "Well, not a real soldier, but like a soldier of these streets. You should check out my SoundCloud." I was like, "Ah, man, you are winning right now." So you're gonna see some interesting people. He was fun because he was like, "Well, I took too much meth, so I got too high." So then I was like, "Well, I'm too high, so I drink a bunch of alcohol to kind of counterbalance, but then I got too drunk. So then I took more meth and I took more alcohol." It's like, I get it, dude, like PEMDAS, you gotta find that middle zone. I get it. It happens, okay? They're gonna be really forthcoming. Just keep that in mind, but you're gonna have to pay attention to it. And then remember, methamphetamine or stimulants, we're gonna have big pupils. Opiates, downers, we're gonna have small pupils. Yeah, Carter.
And they're usually calm, like they're not gonna be aggressive or anything at all. Like the guy just sounds like he just...
I wouldn't use the word calm. This guy is like not moving the whole time. Like he's like, they're tweaking. But they're typically not aggressive folk. Yeah. Not to say they can't be, but in my experience, they haven't been. Now, cocaine can be taken a number of different ways, absorbed through mucous membranes, so that's why you see people up the nose and their mouth, with the immediate effects being excitement and euphoria, usually lasting less than an hour. And then the most potent form of cocaine is going to be crack cocaine, which is often smoked. We don't have much cocaine here, we're a meth state. Okay, and then acute overdoses. So if someone is overdosing in the moment on cocaine, patients will have a high risk of seizures, cardiac dysrhythmias, and strokes. Okay, Reason strokes are on that list is because it's going to jump your blood pressure. High blood pressure can put you at risk of stroke, but we'll talk about that down the road. Okay. It may also cause the patient to experience hallucinations or paranoia, so don't leave the patient unattended and get them prompt transport. These are patients that they tend to run off. I've seen it a time or two. I've pulled up to a hospital, one in particular, the one St. Alphonsus. I've literally pulled up, okay, we're gonna get the patient out, and then they take off. It is not our job to chase them down. That's when we're gonna let PD know we have a runner. We're not gonna be the one tracking them down, okay? Once again, keep yourselves protected. This is also gonna be one of those situations where if they're gonna take things like, wait, no, actually I'm double checking something. Give me a second. Hold on. Okay, yeah, I got more that I'll talk about when we get to hallucinogens, because things like LSD, mushrooms, ketamine, those all pop up there. Okay, so bath salts. Bath salts is an emerging class of drugs, okay, similar to MDMA or ecstasy. Produces euphoria, increased mental clarity, and sexual arousal. Now, most users of this drug will snort or insufflate the powder nasally, and then the effects can last as long as 48 hours, okay? I'm sure some of you guys have heard of the guy in Florida who ate that dude's face when he was on bath salts, right? Bath salts can cause some massive hallucinations. I'll show you guys one of my favorite videos on the internet that has to do with bath salts here in a moment. But adverse effects will include teeth grinding, appetite loss, muscle twitching, lip smacking, confusion, GI conditions, so diarrhea, vomiting, paranoia, headaches, high heart rates, maybe hallucinations. For us, keep them calm. And then consider ALS. Reasons to consider ALS, chemical restraint, right? We can pharmacologically restrain these people with a shot in the shoulder if they get a little bit buck mild. Now, the teeth grinding and lip smacking are two really commonly seen things. You'll see them kind of doing this, right? Moving their jaw back and forth, grinding their teeth. And the lip smacking is one of the most annoying sounds in the world, but it's a quick identifier. They're literally, while they're just talking, sitting there talking to you. It's really annoying, but it's a good identifier of like, oh, you took something you definitely shouldn't. That shows up with methamphetamine too. Okay, let me show you one of my favorite YouTube videos that has to do with bath salts. So, as you can see, bath salts is one of the type of drugs that gives you temporary superpowers. It also definitely affects your mentation and puts you at risk of a lot of things. PCP is another type of drug. Well, it temporarily gives you superpowers. When I was in high school, our SRO was a former South Central police officer, and he told me a story about there's a guy on PCP who was attacking him, and he took his ASP, which is that metal baton that police carry, and he hit this guy in the leg so hard, which my SRO, for reference, was like 500 pounds, giant man. 500 is an exaggeration. Big, big buff dude. He bent his ASP around this guy's leg, and he kept fighting, okay? If you get hit that hard with something, most people are done, right? So keep that in mind, right? If we're gonna be dealing with these folks, this is definitely, okay, maybe we should get ALS en route. Just on the off chance, we need to sedate them, okay?
How is that? What's like happening that causes that to be possible?
What do you mean? Like what causing what to be possible? The superpower?
So like, yeah, not.
It's dissociation from the drug, and also, because remember, substances create lack of awareness, right? They lower the thresholds for awareness. So their pain thresholds almost cease to exist. They become so dull to that. Essentially, yeah, they're not getting the sensation messages. Yeah, pretty crazy stuff. Okay, the next one, marijuana. So marijuana is abused throughout the world, with THC being the chemical in the plant that produces the high. Okay, so euphoria, relaxation, drowsiness. This does impair short-term memory, as well as the capacity for complex thinking. Excuse me, and then can progress to depression and confusion. A lot of times people who are chronic THC users actually start developing depression, and that's because of the constant dopamine influx they get from the drug itself. Okay, so with very high doses, patients may experience hallucinations, become anxious or paranoid. Okay, that's the one we typically tend to see. For us, reassure the patient, transport them with a minimal amount of excitement. Okay, And then often marijuana is kind of the vehicle drug of choice. People lace it with things. I did some research on it. To overdose on marijuana in a single sitting, you would have to smoke about 13 pounds in an hour. That is an obscene amount of marijuana, undoable. So for us, we just have to reassure the patient. They might get a little sick. It's not uncommon for them to start vomiting. But outside of that, we're just going to kind of keep them cool, calm, collected. Okay? We see the paranoia quite a bit. That's usually what happens. We get THC overdoses from time to time. And usually as someone gets too high and they're paranoid that they're going to die, they want to go to a hospital, which depending on the provider, I used to say, do you really want to spend the next 3 hours in a hospital like this, or would you rather watch a movie with some chips? You got choices. But end of the day, if they want to go to a hospital, they need to go to a hospital. I had one gal who was cleaning her daughter's room. She was an older lady, older 40s. And she was cleaning her daughter's room, found a chocolate bar in her daughter's dresser, decided she wanted to eat that whole chocolate bar. That chocolate bar was 100 milligrams of THC. She was pretty upset, panicking, couldn't stop crying. She said she could hear her heart beating. I don't doubt it. She wanted to go to a hospital. She was just that paranoid, okay? It happens. Now, obviously, it's legalizing across the country. Our state's not included in that list, okay? But the ones that we're starting to see problems with is edibles, right? Because they make all sorts of them, cookies, chocolates, all sorts of things. And it's not so much adult usage, right? We know adults are not gonna die from this. But kids, it can be damaging to pediatric brains, okay? And if it looks like a chocolate bar, a kid's not gonna know the difference, okay? And then ingestion can lead to cannabinoid hyperemesis syndrome, where you take too much cannabis and you vomit, okay? It can also cause what's called cyclic vomiting syndrome. So people who are chronic users, like heavy chronic users, it's not uncommon for them to wake up in the morning, first thing they do is vomit and then smoke. It happens, okay? Chronic overuse. Questions on this at all? Okay, so there's also synthetic marijuana or spice. This one I feel like is kind of going out of popularity. Haven't seen it in a while. When I was in high school back in 2010 to 12, this was pretty prominent. It was actually legal here for a little while. It was being sold out of tobacco shops because there was no legislation on it. But it's a variety of herbal incenses that resembles a similar high to THC. It did have more harmful effects though. It's unpredictable, ranging from simple euphoria to complete loss of consciousness. I've also heard, this was through the grapevine when I was in school, people having seizures and things of that nature because of the oxygen displacement because of what they're smoking, okay? Like I said, not typically seen as frequently anymore, at least not around here. Could still be out there, but it was one of those things that was popular about 10 years ago. Okay. Hallucinogens. So hallucinogens alter a person's sensory perception, with the classic example being LSD. But we give one of these therapeutically at the Medic Scope, and that is ketamine. The goal of ketamine is to dissociate the patient. Essentially, they're going to feel the pain, they just don't care. When I was telling you guys about that kid who dislocated his kneecap weird, right? Gave him a lot of ketamine, and I was pushing on him, he's like, oh, it still hurts. I was like, do you care? He's like, not really. It's like, okay, then it's working, right? The med's doing its job. We can use it therapeutically. Now, the big ones, ketamine, LSD, mescaline is peyote. Nutmeg, if you didn't know, if you eat enough nutmeg, it can actually be a hallucinogen. It's also really bad for your internal organs, so keep that in mind if you're gonna try that. Psilocybin, and then salvia. So, these agents can cause visual hallucinations. They can intensify your vision and hearing, okay? They generally, what they do is separate the user from reality, okay? They're dissociates. They dissociate the person from what's going on. Now, when we show up and we see these, it's typically the person having a bad trip, okay? So hypertension, tachycardia, anxiety, and paranoia, which if you think about it, anxiety and paranoia, right? If you're really anxious, what do you think your heart's doing? It's beating fast. If your heart's beating fast, your blood pressure goes up, right? So this is all tied together. Once again, these substances can definitely do damage, but in low doses tend not to have a big overdose threshold, okay? Our biggest thing is people having a bad trip and then potentially harming themselves because of what they're experiencing. I've had this a few times where one of my last ones was a kid, I wanna say like early 20s. He was out really far East Boise, almost a stage stop. He was at a party at his friend's house, and he decided he wanted to leave after taking mushrooms and just started hoofing it. Ended up in the middle of nowhere, and then the whole time he's like, am I gonna die? I'd be like, no, I don't think so. And he'd be like, oh, I don't believe you. And that was the whole thing, just back and forth. He was big old pupils too. Okay, so for these folks, calm, professional manner, provide emotional support. Okay, try to keep them cool, calm, collected. Don't use restraints unless they're a danger to themselves. You're just gonna freak them out even more, okay? Watch them carefully, because they can, once again, be runners, okay? And then request ALS assistance when appropriate. So, couple of stories on this. These are people that we don't want to confirm their hallucinations, right? If we're in the back of the ambulance, they're like, oh, that's a big spider, giant spider. We're not going to be like, where is it, right? But we will say, this is what I've said historically, I don't see the spider. What does it look like, right? Ask them. It sometimes pays off to play into their hallucinations to help keep them calm, right? I'm not confirming anything, but if you can play into it. A story told by one of my teachers was him and his partner were dispatched to a guy who was hallucinating on something. When they showed up, he was in his living room. He had a couch here, couch there. When they show up, he's like up on his couch and he's all hunched over like a gargoyle. And they're like, you know, come on, man, we got to get you to the ambulance. He's like, I don't know how you're walking on the floor. It's lava. And so my teacher's partner, in a moment of brilliance, grabbed the couch cushions from the other couch, threw him on the floor, and he's like, quick, jump across the rocks. And so the patient is like, okay. He runs across, and he gets outside, and they're able to have a cool, calm, collected drive to the hospital. So sometimes playing into it pays off, okay? It does help. But don't leave these people unattended, especially if they're really, really paranoid. I picked up a gentleman in Garden City one time who, this guy definitely pooped his pants, just for reference later. He was definitely hallucinating on something. He was paranoid, thought these people were following him. Now, we were sitting in the back of the ambulance, it was me and my partner. My partner was a pretty successful wrestler at one point in time, okay? So when he gets his mitts on you, you ain't going places, okay? So I'm sitting there, I'm sitting across from him. Has anyone had their clinical yet? Okay. Well, when you guys get in the back of the ambulance, you'll see there's a chair, the gurney, and then there's a big bench seat. So I was sitting in the chair, he's sitting across from me on the bench seat. And I can see him fiddling with the seat belt, and we're going down Chinden, going 40. It's like, come on, man, we don't need this. Sure enough, he undoes his seatbelt, tries to open the back door as we're moving. Fortunately for me, he grabbed the wrong door handle, the second door to open. It gave me time to grab him by the belt, and I slung him back to my partner, who then got him in his big old bear hug. Now, once again, this guy pooped his pants. They were doing the prom pose, you know, like front to back there. So he was holding this poopy guy for a good few minutes until we were able to get him calmed down enough to sit back down and chill out, okay? Be cognizant. These are the kind of folk that will try to run on you, especially if they're that scared, right? We'll talk about, when we get to psychiatric problems down the road, about dissociation and kind of their frame of view. Yeah?
Have you ever had someone on hallucinogens see animals?
See animals?
Yeah.
Not off the top of my head. I've had one gal who was murmuring like a demon. It was with the same guy who caught the guy. I haven't thought about this in a while, but she was wearing one of the helmets because she was in a wrap because she was trying to hit her head. She was butt naked in the middle of the road. And then when we lifted up her helmet, she was saying words and like big old eyes staring at him, and he just put it back down. Then we finished our transport to the hospital. It happens, right? End of the day, we're still trying to be dignifying, give these people the respect they deserve.
A big old wrap?
A wrap. So the wrap is a thing the PD will put people in. It's essentially law enforcement. Yeah, they cuff you behind your back, they tie your arms and legs together, and then they string your chin to your knees as handles. We can pick them up and maneuver them. And then they'll put a helmet on them because a lot of times they'll start slamming their head on stuff. So she had one of those. They almost look like the foam karate helmets, basically.
I got to practice with one of those because I went through like a small police academy
Yeah.
and they like showed me how to use it. It's actually really cool.
They're really convenient for getting people places, I can tell you. The handles on the side when people are spitting and doing the whole thing, and you're just like, I know, come on, let's go. It's fun. It can be fun, or it can be awful. Really depends. Okay, so moving into some different types of drugs. So we have anticholinergic agents, okay? So when we talk about the sympathetic nervous system, fight or flight, what's the hormone that we're dealing with again? Epinephrine, adrenaline, right? There's also a hormone that's associated with our parasympathetic nervous system, okay? It's called acetylcholine. You don't necessarily need to know that, but that's what it is, okay? Now, acetylcholine is our cholinergic agent. So if it's an anticholinergic agent, it's basically saying our rest and digest is not going to happen. Okay? So this statement, hot as a hare, blind as a bat, dry as a bone, red as a beet, mad as a hatter, is a descriptive statement regarding what symptoms you'll see. They're going to be warm to the touch. They're going to have visual problems. Oftentimes it's photosensitivity. The light's going to hurt their eyes. Okay? Their skin's going to be really dry. Well, they're going to be hot and dry, so they're going to have red skin as well. And then they're going to be altered. Okay? Now, the common drugs we see, atropine, Benadryl, Jimson weed, and amitriptyline. Benadryl, obviously that is one that's kind of going around right now on the socials with kids doing stupid things and overdosing on Benadryl, trying to see the Hat Man, right? Everyone's heard of this guy by now.
What?
The Hat Man. Oh man, that's crazy. It's not worth it because people, this is one of those that slowly is going to damage your organs. But moving on. The amitriptyline, that's one that is it's an old antidepressant. It's not typically prescribed anymore. It's kind of going out of favor, but that's a tricyclic antidepressant that has anticholinergic effects, okay? So death can happen because of these TCAs. It's one of those pretty common ones. To the point if you work for Ada County, that is one of the topics they really, really harp on. They want you to know TCAs. Okay, like I said, they're going out of popularity, but they are still prescribed. For example, you guys all saw the picture of my mom's head, right? She is prescribed amitriptyline for migraines. It happens. I'm not a fan of it, but that's what she's been prescribed, okay? So these patients can go from normal, acting normal, to seizure and death within 30 minutes if they overdose on them, okay? So what we do, transport fast, maybe get ALS. We can give medications to help with these, okay? These can also make people, I've heard, have some pretty strong sedation effects. I know a medic who, he said that, I can't remember why he was taking, I think it was for the antidepressants problems, but he took it on a Friday, was prescribed, took his prescribed dose on a Friday evening. He woke up Sunday afternoon. He slept for like 36 straight hours because of how sedative prominent these can be, okay? So they can see a number of effects, but the big concern is overdose, death within 30 minutes, okay? On the flip side of that, we have cholinergic agents, okay? Cholinergic agents are like nerve gases. So this is like mustard gas is a cholinergic agent. So it overstimulates normal body functions that are controlled by the parasympathetic nerves. What is our parasympathetic nervous system again? Rest and digest. So it's going to make all of our rest and digest situations worse, okay? Now, we don't typically obviously see chemical warfare type things around here, but organophosphate insecticides is possible. We have some very rural areas around us, a lot of farmland. They can, depending on what type of insecticide they're using, overdose on that. Okay, so there's two mnemonics. You can use dumbbells, but I like this one better. This is the one I talked about earlier, Sludgeum. Okay, so salivation. These people are going to be drooling and sweating excessively. Okay, lacrimation. What's lacrimation mean? Give you a hint, our lacrimal gland lives near our eyes. Yeah, what is this? Tear ducts. They're going to have excessive tearing. So salivation, sweating, tearing. They're going to have urination, uncontrolled urination. They might have uncontrolled defecation, drooling, diarrhea. Okay? That kind of ties in with that GI upset and cramps, right? If you're having diarrhea, nausea, vomiting, that's pretty upset stomach. Emesis, so vomiting, and then you might have muscle twitching, okay? Meiosis, which meiosis is going to be pupillary reactions, okay?
Can you say emesis is just
vomiting?
Yeah.
Yeah, emesis. That's why, like, when people ask for a puke bag, they're called emesis bags. That's how I put two and two together.
You said meiosis is eye.
It's a pupillary response. Very good.
There's a different meiosis with a Y?
Huh?
Is there a different word meiosis with a Y? No.
With a Y? Not that I've heard. Why? Are you thinking like mitosis and meiosis?
Maybe.
Like cellular division?
Yeah.
There is meiosis.
Is it spelled like that?
No. I think that is the one with the Y. I see what you're saying.
That's what I was
Okay.
going for.
Yeah, no, you're good. I get it. Okay. So most important considerations. One, we got to avoid exposure ourselves, right? Especially if we don't know what they're getting into. So decontamination may take priority over transport. Hazmat will provide that decon as needed, right? And then after decon, decrease the secretions in mouth and trachea. How can we handle secretions in the mouth and trachea? Suction, right? And then airway support's gonna be a big one. Now, there is an antidote kit. We don't carry it on every ambulance. The supervisors and like battalion chiefs do. It's called a duodote. Okay, so if you get this in your own system or you get involved, or we can even get it for the patient, it's a single dose auto injector containing atropine and pralidoxime. Now, atropine was one of the medications that people can have an anticholinergic reaction on. Okay, so what atropine does is it stops our rest and digest from happening. It's a med we give therapeutically, actually. It brings the heart rate up. By stopping the rest and digest, it just makes the heart rate increase. So we will actually give atropine in moments of organophosphate poisonings. Now, downside is it takes a lot of atropine. To the point at Ada County, we didn't carry enough atropine to actually fix the problem. They need like 5 milligrams, and I think we carried like 2.5 or 3. So we didn't carry enough, yeah.
So is it like an EpiPen?
No, we administer IV. Oh, the duodote, yeah, it's gonna be an auto injector. Yeah, EpiPen, sorry, good point. So, known exposure to nerve agents with manifestation of signs and symptoms has occurred. You can use it on yourself as need be. I saw a video, this was back when I was paramedic school. I've searched for it, I haven't found it, probably for good reason. But if you show up on scene and you see a tank on its side, potentially open, pay attention, maybe we don't approach. Now, if say it's a gas, where do you think we should park? There's some considerations. Downwind? Upwind, right? We want to park upwind, because if it's downwind, that's going to float on us, right? But in this video, there's a farmer tipped over his tank that he was carrying. I'm assuming it was gaseous. And first person on scene was a police officer. So this footage I saw was pure dash cam footage. You see the police officer get out, sees the man down. Obviously, he's trying to help, do his best. This is where paying attention to hazmat makes a difference. You actually watch this poor police officer go into cardiac arrest and die because he ran into a hazardous material around him without paying attention. It wasn't until fire showed up on scene 5 minutes later that they were able to get a hold of him, okay? If you see a situation where there's potential hazmat, take care of yourself, right? Make sure you're paying attention. We all want to go home to our families at the end of the day, okay? So miscellaneous drugs, obviously there's a whole lot out there. The big things we got to be considerate of: accidental or intentional overdose, okay? Especially cardiac medications, kids and old people. Kids because they don't know, old people there's lots of reasons, right? Older patients, if they have dementia, Alzheimer's, they take the wrong amount of pills or they take the wrong day, right? Or there's all sorts of circumstances. If they're in a nursing home, they take the wrong persons. I've seen that before in like it was a home for the developmentally delayed, but there was a kid who got a hold of other people's medications, just took theirs without thinking about it. Okay, it happens. Pay attention to it. Mistakes happen all the time. So, signs and symptoms are going to depend on the medication. So contact poison control. Remember, it's not inappropriate to use your phone if you're looking something up. I used to Google meds all the time. There's so many out there that we've never heard of. It's okay to use Google to find out what a medication is, okay? Now when it comes to, some different things. So aspirin poisoning, that's a potentially lethal condition. Aspirin poisoning, aspirin overdose, is a long, slow, painful death, okay? This is one that we typically see with like youth. I want to say before I left the field, I was seeing an uptick in 14 to 15-year-old suicide attempts. And a lot of times it was things like aspirin. Well, aspirin is going to kill your kidneys because that's how you process it out. And you're going to overwork your kidneys to the point you go into kidney failure. And it's going to be a long, slow, not fun way to go, okay? But you might also see nausea, vomiting, hyperventilation, and then ringing in the ears. What's that fancy word for ringing in the ears? Tinnitus, yeah. So we might see patients with anxiety, confusion, tachypnea, hyperthermia, potentially seizures if they're overdosing on aspirin. Acetaminophen is another common one. Now some alcohols include methyl alcohol and ethylene glycol, are even more toxic than ethyl alcohol, okay? Ethyl alcohol is drinking alcohol. To the point, I want you guys to write down, ethyl alcohol is also known as ETOH. ETOH. Okay, and the reason I want you to write that down is some hospitals you bring people to, they're going to ask you, what's the chief complaint? And you're going to tell them, we're here for X amount or X reason, right? It's not the nurse, they're just trying to find us a room. I've had a couple circumstances where I've had someone who I was able to talk down, keep calm, but they're extremely intoxicated, potentially volatile, and they walk up, what's the complaint? And I said, ETOH. ETOH, they're not listening. I said, alcohol intoxication. And that right there was enough to get that patient to explode and start getting angry and hard to manage, okay? ETOH is the way we'll describe it to the hospital, and hopefully they're paying attention, okay? I do want to backtrack. Oh yeah, go ahead, Bryce.
That was for alcohol abuse? Like that's the code?
Ethyl alcohol. It's the drinking alcohol.
Oh, okay.
Yeah. And then like rubbing alcohol, for example, do not drink rubbing alcohol. First off, it's going to make you go blind. Fact, it will make you go blind. Second, it will kill you. My grandfather, he was from South Dakota. He grew up just outside the Sioux Native American reservation there. He said it was not uncommon when he was growing up that they would see dead natives on the side of the road because they would filter their rubbing alcohol through bread and then drink it. And then obviously it would kill them. They'd freeze to death outside as well. That didn't help anything. So just keep in mind, rubbing alcohol is problematic. And if people are so alcohol dependent, they might start looking for any option they can, like drinking hand sanitizer is another common thing I've heard. Yeah, question?
You just said hand sanitizer, but there was a kid a couple years ago at Centennial High School that did that, I remember.
Yeah, drinking hand sanitizer.
Hand sanitizer, chucked the gallon of hand sanitizer.
Yep. Did he die? He was blind.
I think it was very aggressive, though.
I wouldn't doubt that.
With the aspirin,
Yeah.
is there any intervention, not in our scope, but
Not in our scope. No.
in the hospital? Like,
I don't know what they're going to do there, but even in my scope, there's not much I'm going to do. Outside of maybe giving them fluids but then at the same time, probably not that because I don't want to overwork their kidneys. Yeah. So it's just going to get them to the hospital and let them do what they do best above our pay grade. Yeah, I'm not sure. One thing I want to talk about if we have overdoses, right? I should have mentioned it when we talked about it. We'll talk about suicide again later. But if we have someone who attempts to overdose on like their own medications, when you're prescribed a med, it's going to have the date that it was prescribed, obviously your name and everything, and it's going to have how many pills are in that bottle, okay? You're going to have to do some math. Bring those pill bottles with you, right? If it's January 1st and they're prescribed that medication January 1st and we show up January 20th, and there's only 10 pills left, they're probably taking it as prescribed, right? But if we show up January 4th and there's 30 pills in that bottle and there's only 10 left, we know they overdid it, okay? Now, also on this bottle, it's gonna have the dosage for the medication that they took. You're gonna have to do some math. Okay, if they took 20 of their 30 too soon and each one was worth 50 milligrams, this is the total amount of milligrams they took. Okay, you can even multiply that into grams if you're good with conversions. Okay, but that's
the conversion thing you said earlier?
King Henry. I'll tell it to you later. King Henry died ugly drinking chocolate milk. Is how I remember it. But it's a way to write them all down. So I friggin' hate you. King Henry died. Okay, so this stands for unit. So like this is just a general like gram, liter, but then we have, so kilo, and this is, I want to say hecto, and then deca, and then deciliter, and then like centi, and then milliliter, milli, and then south of that is going to be like micro, and so on and so forth. It's just a different way for the unit conversion. That's how I learned it a long time ago. But yeah, okay. So food poisoning, right? Almost always caused by food contaminated by bacteria. Okay, so there's two main causes. Either it's the organism itself that causes the disease, or an organism may produce toxins that causes disease. Okay, so I actually saw a thing recently, like people, does anyone like oysters in here? Like oysters in the shell, half shell? Cool. Well, I saw a gal who died because she ate some the other day because they had bacterial amoebas in them and they ended up getting into her brain and killed her. So just because you put vinegar or lemon juice on them doesn't mean you killed the bacteria. Okay, fair warning. I don't like them, so live your life. So one organism that produces the effects of food poisoning is salmonella. We've all heard about this one, right? Where do we get salmonella from? Raw eggs? Chicken is another big one. Yeah, so we don't cook our chicken medium rare, right? Fully cooked, well done chicken. But chicken's the big one. Yep. Now, causes of salmonellosis. So what we're gonna see, they're gonna have severe GI symptoms 72 hours after eating it. So nausea, vomiting, abdominal pain, diarrhea. They are gonna be purging on every end they got, okay? That's why you gotta cook your food. If you properly cook it, it's gonna kill the bacteria, okay? And then make sure you're keeping your kitchen clean because we don't want cross-contamination. For those of you planning to go fire, if you're gonna be a probie, you're gonna be cooking a lot, okay? Make sure you're not cross-contaminating. You're not putting your chicken with your vegetables, proteins with your veggies at the same time. Cut them on separate boards or wash and clean the boards in between. Because the last thing you want to do is get an entire crew of firefighters sick. You are never going to live it down, I promise. So the more common causes of food poisoning is the ingestion of toxins produced by bacteria, usually in leftovers. So one of them being Staphylococcus. It's quick to grow, produces toxins in food. Okay. Foods left unrefrigerated in vehicles, or left unrefrigerated in vehicles is not fun. I have a story I'll tell you in a second, but food left unrefrigerated is a common vehicle with symptoms starting 2 to 3 hours or as long as 8 to 12 hours after ingestion. The reason I kind of chuckle at myself with food in the vehicle is because when I was in college, one of my best friends, or rather in high school, my best friends and I were getting recruited to the same schools. So we went on a recruiting trip, and part of it we went to lunch, which was just like the grocery store to get like their hot food case, like the chicken strips and stuff. So we got some chicken strips, ate lunch. He decided, I'm gonna save this for later, and he left it in my dad's car for like 6 hours. It was 97 degrees out, it was hot. He came back, we had a 30-minute drive, or 45-minute drive back to where we were staying, and he was like, ooh, I'm hungry, and he ate those. He then proceeded to spend the rest of that evening vomiting with diarrhea. So don't leave your food, especially chicken, in your vehicle and then eat it several hours later. It's just not a good commonsensical move, which checks out. He's the same one who brought the stool softener for his brother. Not a smart boy, but it happens. So the most severe form of toxic ingestion is botulism, okay? This is gonna be improperly canned foods. This is why your parents always told you your whole life, if you see a can that's dented open, don't buy it, because there's potential botulism. Botulism will kill you. It's a neurologic toxin. Okay, so blurring vision, weakness, and the difficulty speaking and breathing will start showing up. Okay, so do not try to determine the cause of GI problems. We are not doctors. We don't diagnose. We just got to get them to where they got to be. Okay, we can have strong suspicions, but we're not going to be like, this is for sure botulism. That's for sure salmonella. We don't know. We can't do the lab work. We can't do the cultures, so on and so forth. Okay. Now, when 2 or more people have the same illness, it says take along suspected food. In my experience, if you take along something that is potentially food poisoning, it's the same thing as when you show up with a bowl of their vomit or their poop. They're going to go, thanks, garbage can. Okay. Now, that's real life NREMT. Take it along with you. Okay. All right. Last 4 slides. Hang in there with me. We're almost done. So, obviously, there are tens of thousands of plants. I don't know them. I'm not a botanist. I'm not that type of person, okay? So if you're curious about this, you're gonna have to look into them. So there are tens of thousands of cases of plant poisoning annually, with many household plants being poisonous if ingested. The one I know for sure, everyone know like poinsettias, like Christmas time poinsettias. Make sure if you have a cat or a dog, they don't eat those. It will kill your cat, okay? I know, because rip, I had one. So, yeah, too soon, right? Anyway, it is impossible to memorize every plant or poison, let alone their effects. Hint, hint, poison control is again important to have in your phone. Assess their vital signs, let the poison control center know. And it says take the plant to the emergency department. Once again, I'm not gonna bring something potentially lethal into an area full of sick people. Just not gonna do it, okay? A story my paramedic teacher told me. He was a medic down in Las Vegas for a little while. He was telling me a story about how they showed up and to this call for I think it was a psych patient. And when they showed up, this gal was sitting in a bush and eating these yellow flowers. Well, my teacher's not from that area, so he didn't know what it was. His partner was very panicked about it. Turns out the flowers that she was eating were a common ingredient for a medication called digoxin. Digoxin is a cardiac medication. So they had to take her in, right? So you just never know. If it's one of those things, maybe be familiar with what kind of plants are in your service area. Fun facts about digoxin. It was commonly because it produces bright yellow, or those flowers, they're bright yellow flowers. Well, people can start actually developing digoxin poisoning after being around and exposed to it. Part of digoxin poisoning is you start to see yellow all the time, everywhere. And there's a very famous painter who notably had digoxin poisoning. Anyone know who I'm talking about? Think about someone with a lot of yellow in their work. Maybe crazy, missing an ear. Van Gogh. Yeah, Vincent van Gogh. Starry Night, sunflower field, right? He was having digoxin poisoning, so he was using a lot of yellow because in his visual realm, he was seeing lots of yellow. Fun facts. Yeah, they use the flowers for paint. So moving on, just some different examples, right? So Dieffenbachia, mistletoe, castor bean, nightshade, foxglove, rhododendron, all of these are toxic plants if consumed. Jimson weed, death camas, poison ivy, poison oak, pokeweed, roseberry pea, and then poison sumac. I actually read about poison sumac. On the East Coast, there's another type of sumac that the natives used to make tea out of, or like lemonade out of it, like a refreshing drink. Fun facts. But around here, definitely poison ivy, poison oak, right? So poison ivy, poison oak. Anyone know the little rhyme that comes with poison ivy? Don't touch it. Yeah, that's good. What was it?
3 leaves.
Beware of me. Yeah, I have 3. Beware of me. 3 leaves. Beware of me. Yeah, it's that 3-leaf stem at the ends of it, like that. It's poison ivy. Also, if you get exposed to poison ivy, you get it all over your clothes. Wash that piece of clothing by itself several times before you throw it in with other clothing. Reason being is you can actually spread that around to your other clothes if you wash it all in one big load, and then you got problems. Okay, yeah, imagine your underwear. So, move.